Let's continue taking a look at supraventricular tachycardias. The way that this is set up is so that we haven't given you all four. I haven't given you all four tachyarrhythmias here so that you are not confused as to which one is which. There was a discussion with atrial flutter and atrial fibrillation, and we distinguished between the two very clearly. Primarily in terms of its description, irregularly irregular would be which one? Atrial fibrillation. If it's regular and you have a 2-to-1 type of pattern, which means 2 P waves for every 1 QRS complex, then you have a regular rhythm, and this would then bring us to flutter and sawtooth. So those were the 2 supraventricular tachycardias that you need to make sure that you know in great detail. And then here we'll take a look at 2 others, one known as multifocal atrial tachycardia. Now we'll do the same thing. Do not allow the name to fool you, confuse you, and frustrate you. In fact, use the name to then clue you in as to the diagnosis of your patient. So multifocal atrial tachycardia is once again dealing with the atria. Thus, it's a SVT, a supraventricular tachycardia. Keep in mind that the objective at all times is to make sure that you prevent these tachycardias from entering the ventricles. Okay. Now, due to focal pacemaker abnormalities, I'll tell you what that means in a second. And what you end up happening here is multifocal or multiple ectopic pacemaker firing. And by pacemaker, we are referring to our SA node. Thus, the P wave is going to be quite operative for us to pay attention to, leading to tachycardia, of course. Rapid abnormal P wave, well, that once again doesn't tell you a whole lot except for the fact that this is an SVT, right? And once again, obviously here, this is before the QRS complex. Not so much obvious, but the abnormality in the P wave is taking place prior to. The patients, well, here once again, because you have tachy, well, the heart is feeling a little pulsating, thus palpations. You have irregular heart rate, fatigue and angina, dyspnea. Well, the rest of these are pretty nonspecific. You would find these with pretty much any SVT. Here, once again, the causes a lot of overlap with a lot of SVTs, including hypertension. We saw this that atrial fibrillation, hypertension in elderly patients could be a possible etiology moving into atrial fibrillation. So how do we know? Atrial fibrillation, what happened to those P waves? They were fibrillated. In other words, they were obscure, difficult to find, wavy pattern, not sawtooth. Irregularly irregular. So when we get closer to the EKG that you're responsible for identifying, you will take a look at the pattern of P wave that we'll see here with MAT, multifocal atrial. IHD, ischemic heart disease, hyperthyroidism, alcohol, pulmonary embolism. Well, all of these, once again, would result in multiple types of SVTs, and it really is up to you to make sure that you take each one of these SVTs that we're looking at, commonly asked by basically any professional, including licensing exams, and how do you distinguish amongst the SVTs is what we're doing, aren't we?